Our first speaker is Caroline Desclas. She will be talking about just the medical affairs in terms of workforce well-being and hospital capacity management. Caroline?
Good morning, everyone. I'm Caroline Desclas, Deputy Director of Medical Affairs and International Relations in Rennes University Hospital. And I'm just going to give you first a quick overview of our hospital capacity. So Rennes University Hospital is has 4 sites, and it has 1,600 beds and 223 rooms. I'm not going to go through all the figures, but what is interesting for our conference is that we have 48 ICU beds usually, medical, surgical, and cardiothoracic and vascular beds. Right now we managed to plan a crisis plan in order to be able to convert our usual beds into COVID beds dedicated to COVID care. And this plan can make us go up to 100 ICU beds, and more, about like 200 medical beds can be dedicated to COVID capacity in our hospital. Regarding the video we just showed, the west of France had not been exposed the same way that the eastern part of France, and we are currently hosting 84 hospitalized patients, which is not a saturation level. Paris and the eastern part of France are saturated, but not our part of France. So we also had the chance to have the time to plan our crisis plan. And our doctors will explain you later during the conference how we managed to plan these different levels. Regarding the workforce well-being and occupational health now, I'm going to explain how we managed. So we focused on reinforce and redeploy the working capacities, prevent and protect the working force, and also support them during the crisis. Regarding reinforcing and redeploying the workforce, it consisted in 2 things. First, we had to identify the internal resources and their skills to be able to quickly redeploy our internal workforce into the COVID unities. So we had to identify if our working force had already been working into an ICU department before, and if they were able to be quickly redeployed into the new department, especially if we had to face a quick spreading of the epidemic. And then we had to solicit external forces, because obviously if there is a rise into the epidemic, we had to be helped by the external forces. So we solicit private hospital, liberal practitioner, and also retired doctors to be able to reinforce our team. Then we also had, obviously, to prevent and protect our workforce, mostly because they are really exposed to the virus. So we settled some training for the new staff and for redeployed resources, mainly focusing into hygiene and COVID patient care. We organized this training before they were redeployed. And we also have regular intervention into the units. And we also try to identify the overexposed services that as COVID plus staff to make sure they are regularly trained and have information about how to keep the hygienic rules in the unit. We also focused on urgent and semi-urgent activities to make sure we limited the number of people on site and the number of patients too. And we also developed the notion of core team and support team, and allowed some of our staff to stay home during the beginning of the crisis, to rest and to be able to come to the hospital later, especially if some of our staffs became ill. And finally, we had to work into bringing support to our working force, internal support through psychological support and occupational health hotline. So our staff were able to call someone every day at any time of the day to make sure they've been properly taken care of if they had been ill. And we also organized the centralization of donation and the distribution of it regarding food donation from different industrial economy, and also regarding the equipment, mask, etc. And finally, especially with the HR directions, we also had to take care of everyday life support regarding childcare support, because the schools were closed. So we had to make sure they would have some solutions. And also regarding transportations and housing facilities, especially for the external working force. And also different other small things, but that helps every day our staff, like supermarket dedicated time slots, for example.
So thank you so much, Caroline. I'll hand it over to Dr. Chu. If we have any questions from the audience, this is a great time to go ahead and enter them into the Q&A box. Dr. Chu?
All right, so please go ahead and enter your questions for us about occupational health and well-being. As I'm looking over some of the questions that we have gotten so far related to occupational health, one that I see right now relates to PPE. Is your hospital reusing or decontaminating N95s right now, Caroline?
Just, I'm not going to answer any medical question, because I'm not a doctor, obviously. So I think I leave the medical question to our doctors later during the conference.
All right. So let's take any questions on workforce well-being and occupational health. While we wait for those questions to come in, one thing that I think seems to be quite common here is, a lot of psychological stressors. Well, I know you can't speak to medical, but has your hospital developed any comprehensive programs to support the workforce in that regard?
Yeah, we are working with the occupational health team every day. Like every week, we have a meeting with them, and we developed the psychological support hotline, internal hotline, that was given to every working force in the hospital. They can call them, and we are also working currently into a guide that will be given to every workforce too, that will be focusing into some advice, but also into psychological support, and also how to manage the everyday life when they are, for example, into a weekend, and they also want to level down the level of stress. How they can exercise while they are at home, etc. So we are working in the whole comprehensive program to help them at work, but also at home.
Great. Dr. Kadri, do you have any questions to add on here?
No, I think Caroline, it's a great perspective.